Welcome to Deuk Spine Institute. We're streaming live spine surgery. Our patient is here with several problems. Most notably, she has back pain coming from her facet, F-A-C-E-T joints on the left side at L3-4, L4-5, L5-S1. She also has pain coming from the piriformis muscles on both sides and her sacroiliac joint on the left side. We're going to be treating all of these areas. We're going to start by treating the facet joints on the left at L3-4, L4-5, L5-S1. So if you have questions, feel free to ask them. In the meantime, we're going to localize, and we need a few more minutes to get ready. Right, Dr. B?
Yep.
Shot. So Henry, let's show the audience what are the causes of back pain, those 30 different things that cause back pain.
Of course.
I'm Dr. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly,
okay, sorry we had to cut that video short, but I want to show you guys what we're doing here. We are burning the pain nerves that go to the facet joints that transmit pain signals up to the brain. You can see the facet joint right there. Jordan is showing it to you right there. And the facet is huge. It's big, full of arthritis. That's why she's having pain. Now, the nerve that goes to the facet joint is right where the arrow is, and I'm going to go in there and destroy it. But we've already destroyed 2 of them at the 2 upper levels. We got 2 more to go. That's why I ended the video, because the surgery is progressing so well for her that if I just keep showing you that video, you're going to miss the whole burning of the pain nerves. Now, we call this burning of the pain nerves a rhizotomy, all right? And I did not discover rhizotomy. The idea was developed a long time ago by people much smarter than me, but unfortunately, no one has ever been able to do a rhizotomy properly until now. And the reason, Shot, is because rhizotomies have been done by pain management doctors, and they're done basically using something called a radiofrequency ablation procedure, or RFA. Shot. The problem with RFA is it does not work and it does not last when it does. So patients end up having to come back over and over again and getting their procedures done over and over again. And this treatment, we are trying to develop a permanent fix. And that's what this treatment is. It's a permanent rhizotomy. The way you do a permanent rhizotomy is through transecting the medial branch of the dorsal ramus, perineurium, and epineurium, which are the coverings of the nerve. As long as you can cut through those coverings completely, which is what I'm doing right now, using a wanding technique called the Deuk plasma rhizotomy, as long as you cut through those sheaths, then you will give the patient a permanent effect, a permanent pain relief. I could feel the massive amount of arthritis, bone spurs and scar tissue right here. All right, 3 down and 1 more to go. All this is being done through a 4mm incision. Shot. All right, target is going to be shot. Shot. Yep, that's target right there. You agree, Jordan?
Yes, sir.
That is the target. That is the perfect spot to get the L5 dorsal ramus. The L5 dorsal ramus is the bottom pain nerve. Shot. That's it.
Yes, sir.
Shot. Want to be a little bit, that's perfect. See how arthritic that facet is, folks?
Yes, we do.
Shot. Oh, it's bigger than that. Show the whole thing. Nope. Yes. That's it. Humongous. Shot. Okay. Shot. All right, we're done with the lumbar facets. I'm going to move on to the SI joint next. So you can end the stream and we'll come back and do a left sacroiliac joint Deuk plasma rhizotomy.